Okay, morning everyone. Hi. My name is Karen Gaynor. I'm the Programme Manager for the Obesity National Clinical Programme, which I'll explain what that is about in the course of the talk. And just thanks very much to the team here in Loughlinstown for inviting me to speak today. And thanks, Jean, for giving such a brilliant introduction, actually. And as I'm going through my talk, it's a lot about policy. It's a lot about, what the response is nationally to obesity treatment and care and providing that nationally. But I will, as I'm talking about the policies that we have and the initiatives that we have, I'd like you to keep an eye out for the stigma and the misunderstanding that is out there, and especially given the context that Jean has just explained. I think it's interesting to watch out for it. Okay, so as I said, I'm going to talk about obesity care in Ireland. First of all, who's responsible for that? And I'll take you through the model of care and the development of that, and focusing specifically, I suppose, on bariatric surgery services, or level 4 in the model of care, and look at, I suppose, how we're going at the moment about implementing those services and what the programme is doing going into the future as well. So just a bit of context, obesity in Ireland today. So again, we've got some figures there at a population level. We've got 23% of adults, and again, have obesity. Do we know that? I mean, that's based on BMI data, and 37% of adults are living with overweight. We know as well that, again, as Jean articulated, body weight, and again, it's said here, may not be a choice, and it does acknowledge the stigma, so weight bias and obesity stigma it does exist for adults and children. We've got there the costs of childhood obesity and also the association with other chronic diseases. So the prevalence again of obesity and overweight in Ireland in the context of other European countries. You can see there we're in line really with other European countries. But if you look here at the amount of surgeries that we do compared to other European countries, you can see there we're much lower, and a real outlier in that regard. So our treatment of obesity is low in this country. So I suppose, what is the national response to that? So the Obesity National Clinical Programme was set up in 2017, and it was a collaborative initiative between the HSE and the Royal College of Physicians in Ireland. And that mirrors a lot of the clinical programmes. There's about 32 clinical programmes in Ireland at the moment, and therefore a range of clinical conditions from chronic diseases. There's also clinical programme, for example, for rheumatology, gastroenterology, cystic fibrosis. There's clinical programmes for trauma services, for paediatric services as well. The aim of the obesity clinical programme is to improve and standardise treatment for people living with overweight and obesity in Ireland to prevent disease progression and development of associated illness. And I think the key word there to think about is treatment, and we were very considered when we included this word, and that was because the context in which the programme came about was very much in a prevention and obesity prevention space. So we wanted to really articulate the difference between obesity prevention and treatment. The objectives are to outline the best practice, the evidence-based integrated services for obesity treatment, to improve quality, access and value, to increase training and education, and also to increase public information and awareness. So just a bit about the policy context and how the programme came about. So the overarching framework that addresses obesity in Ireland is the Healthy Ireland framework, and that's cross-governmental, and so it's multi-sectoral. So it's the government and the HSE are engaged in delivering on the Healthy Ireland framework. From that framework, the Healthy Weight for Ireland Obesity Policy and Action Plan came out. That was launched in 2016 and runs through to 2025. And that outlined 10 steps to addressing obesity in Ireland. There's been other frameworks over the years, so you can see as far back as 2005 there's been policies written about this. And again, just to put that in context of where we're at in terms of delivering on services. We're nearly 20 years on from 2005 now. So part of, I suppose, if we think about obesity prevention and we think about obesity treatment, first of all, to think about prevention, the Healthy Eating, Active Living policy programme within health and wellbeing in the HSE is really focused on addressing obesity prevention in the HSE. So you've got healthy eating, active living, and you've got healthy childhood as well. And along with education and training in the HSE, in this year there was about a 12 million spend on prevention initiatives for obesity. So again, just think about that number, because I'm going to come back and talk about numbers for obesity treatment as well later on. So it's very interesting to compare. But when we think about the clinical programme, we think about obesity treatment. Where does that fit in the obesity policy and action plan? And out of those 10 steps, step 6 is to mobilise the health service programmes to develop training and skills, and also enhanced systems for detection and signposting to services. And then we've got step 7 is to develop a model of care for specialist treatment for children and adults. So out of that step, the programme was born. Now there's other HSE policies and initiatives as well that the programme has to align to. And I suppose if you think about it in the context, we're here talking about obesity today. When you think about the HSE, there's lots of clinical conditions, there's lots of diseases, there's lots of things that need to be treated, and there's lots of deficits and there's lots of gaps. So while we feel like obesity is very important, we feel it should be prioritised, when you go out into the system, you're competing with cancer services, other chronic disease services, service for older people. So all of a sudden, obesity is one of many challenges in the health service. So when we're thinking about how to, I suppose, what are the drivers for obesity, it's important to look to some of these national initiatives that the HSE and the Department of Health are talking about, and align to those where we can to show how obesity fits in. So some of those are around, you'll all have heard of Sláinte Care. So in the Sláinte Care Reform Programme, you've got their Project 4, Implement the Obesity Policy and Action Plan. You've got the HSE Corporate Plan, which one of the objectives there is to prioritise prevention and early intervention services, focusing on children's health, obesity and alcohol. You've got obesity called out in the National Service Plan for this year as well. And back in 2018, actually, which was a precursor really to Sláinte Care, the Health Service undertook a capacity review. So it's looking into the future and thinking, what are the problems and the pressures going to be for the HSE into 2031. And again, one of the main scenarios there for reform was around health and wellbeing, and obesity sits within that, implementing specialist obesity services. COVID was a driver as well for us because of the links and the adverse outcomes between people with obesity and COVID. So there's lots of drivers there as well that we've been able to leverage, if you like, in when we're looking to implement our model of care. So this just outlines the principles of the Sláinte Care implementation strategy, which again is something that we looked at when we were thinking about how do we want obesity services to look. So we went about the obesity programme between 2019 and 2020. We developed the model of care. Now that was with an expert subgroup, a working group, and lots of, I'll take you through the process in another slide, but lots of consultation as well. We started with looking at all the other national models of care and international models of care for obesity, of which there weren't really many, to be honest. I think we're all familiar with the tiered model in the UK, and there's also a model in Italy that's been published. But other than that, very few countries have addressed this at a service level. We looked at all of the policy standard and guidelines, and I suppose just to point out here, one of the main guidelines that we looked at were the Obesity Canada Clinical Practice Guidelines. They were the most recent and the most comprehensive. we looked at other standards of care and other relevant resources, like, as I said, the policies that we have nationally and Sláinte care policies. Jean already alluded to this, but we have, at the moment in Ireland, we have the National Framework for the Integrated Prevention and Management of Chronic Disease. Now, this the chronic diseases that are included in this framework include respiratory disease, heart disease, and diabetes. And I suppose really obesity should be there as well, shouldn't it? So although we're not included in that integrated framework, we felt it's important to align obesity as much as we can to this framework, and that will give us the best chance of implementing services in line with what is happening for other chronic diseases. So the objectives of the model of care were to set out how healthcare for children, young people and adults living with overweight and obesity in Ireland should be organised and resourced now and into the future. And it describes the type of service required, who should provide it and how it should be delivered. And it also recognises the wider drivers of obesity, which Jean again really eloquently alluded to this morning: genetics, the environment and socio-economic status. So the scope was to define HSE services. We didn't look at outside agencies. We didn't look at population-based policy or legislation, and we were really clear it's not a clinical guideline. We also looked at some specific settings and higher risk groups like mental health, disability services, older people, pregnancy, and socially excluded groups. And again, the principles were that to I suppose acknowledge that obesity is a complex disease, and that weight stigma and obesity discrimination will not be tolerated in the healthcare system, that there should be appropriate and equitable treatment in addition to public health prevention measures, and that academic institutions, professional bodies and anyone involved in training and education, obesity care should be incorporated into their training programmes. So again, it was written over a 12-month period. Started out with a writing group with oversight from a working group and then input across the system from other clinical programmes. We had a public consultation in August of 2020, which allowed us to get broad input and feedback from a number of external stakeholders. It was signed off within the HSE in December 2020, and it was approved and launched by the Department of Health the following March. So this is what the model of care looks like. You may or may not be familiar with it. It's a pyramid because lots of things in the HSE are pyramids at the moment, and particularly around chronic disease management. So the lower levels are around prevention and living well with chronic disease, and then as you get higher up through the levels of service, you go through primary care, into secondary care, and then specialist care as well. So for the purposes of today, I'm going to really focus on those upper levels, level 3 and 4. So just to describe what level 3 and 4 services are. So level 3 services, as per the model of care, are physician-led multidisciplinary teams. They undertake detailed clinical assessment, including screening for cause and consequences of obesity, and they provide detailed evidence-based multidisciplinary treatment. This might also include rescreening, treatment or onward referral for eating disorders, trauma and chronic mental health conditions, and also intervention and support for people who may not be suitable for bariatric surgery. They include workup for bariatric surgery, onward referral or additional interventions before surgery, and also development of specific pathways for people who may need accelerated intervention. And again, Jean alluded to this. So when for particularly complex cases, that we don't have people jumping through lots of hoops or waiting for a long time for the right treatment. Level 4 services are consultant-led multidisciplinary assessment and approval for bariatric surgery with pre, peri and post-operative support. So that includes pre-operative MDT education and support, which again we'll be covering a lot of today, and post-operative follow-up. and post-operative review and follow-up for individuals who've undergone surgery outside of Ireland, and assessment by plastic surgery by plastic surgeon for individuals with excess skin post-op, and it can also include inpatient rehabilitation programs and palliative care as well. So when we think about implementing the model of care then in this, I suppose, in this system, just thinking about the opportunities and threats that we had when we went out to look at our, I suppose, developing our implementation plan and then looking for funding. So some of the opportunities which I'll take you through were that we did have access to funding streams, because the case is clear that obesity does impact lots of areas in the health service, and we were looking for funding at a time when a lot of funding was available coming out of the COVID-19 pandemic. The evidence and, I suppose, growing understanding that obesity is a chronic disease that should be treated as such is, I think it's coming out there, but we still have a long way to go. We have really strong patient advocacy in this country. So we have ICPO, and they are excellent at increasing the visibility, I suppose, and speaking about obesity as a chronic disease and sharing the patient and the lived experience of obesity. And that's a really strong driver, I think, for getting services funded. We also have real specialism. So even though we don't have a lot of services, we have excellent clinicians in this country who are known nationally and internationally for their work in obesity. And again, that lends real credibility to the work that we do here. We've got engagement with key stakeholders. So clinical lead, Professor Donal O'Shea, has worked really hard to engage with stakeholders in the Department of Health, in government, in departments outside of that, and also with senior leaders in the HSE. And that's really important, because again, if you're approaching senior leaders or decision makers in the HSE, they're not just thinking about obesity, they're thinking about the spectrum of services. So it's important to develop strong relationships there. So again, the evidence base is growing for where obesity is I suppose, I mentioned already the COVID pandemic. So again, that helped us show, I suppose, those adverse outcomes from people with obesity helped show how important it was to address obesity. And also just this summer we had the HTA, which shows the cost effectiveness for metabolic surgery. So that's bariatric surgery for treatment of diabetes. So again, I'd encourage you to look that up as well, actually, because that's very helpful. Although not specifically related to obesity care, it does show the benefits of bariatric surgery. We've also got really good engagement with media and other organisations. So we've got the ASOI in this country, Association for the Study of Obesity in Ireland. If you're not a member, I'd encourage you to join. It's a great organisation that advocates for obesity care, but also is able to engage with media maybe in a more responsive and flexible way that sometimes we are in the HSE. And again, that all serves to keep the narrative going out there. And engagement with media, you'd think, well, why are we talking to the media? So it's not just changing public opinions, but it's also, you'd be amazed the amount of meetings I've gone to with senior leaders in the HSE or even government ministers, and they say, oh, I heard a patient on Morning Ireland talking about this, or something on News Talk. So by speaking to the media, we're actually speaking to our funders as well. So some of the threats, though, on the other side to implementation. Again, there's a misunderstanding there between prevention and treatment, and maybe some thought that can't we just prevent our way out of this? So can't we just get everyone or encourage everyone to eat less and move more? Can we legislate for that and change the environment, and then this won't be a problem anymore? So it's very hard to get that message across that treatment is needed and that this is a chronic condition. There's also the sense of, well, if we provide the treatment, then this won't be a problem. We'll cure obesity on a population level. It won't be a problem if we do enough bariatric surgeries. But again, that's not. This is a population thing, and it's a chronic disease, and it's always going to be here. So I think there's still a lot of education to do there. Again, the obesity programme sits in health and wellbeing, and you'll see when I talked about the policies. So obesity is still in a prevention space in the HSE. So where all of the other clinical programmes sit in a clinical design space, so almost like a clinical treatment space, the obesity programme still sits in a prevention space in the HSE, and that makes it difficult sometimes to be taken seriously as a treatment programme. We're also a relatively new clinical programme, so when you compare to diabetes and see where diabetes services are in nationally, and you think, well, diabetes programme has been around about 10 or 12 years longer than obesity. The HSE is extremely complicated in terms of an administration, and there's a lot of bureaucracy. So when you're seeking funding, there's an awful lot of steps to jump through. There's an awful lot of business cases to write. There's a lot of lines of governance that you have to get signed off, and that takes a lot of time. I think we've talked a lot about the stigma and misunderstanding. The prevalence of obesity and the costs of obesity. So when we look at obesity prevalence nationally based on BMI, the numbers are high. So what we need to understand, I think, is what's the actual prevalence of obesity where excess weight or high BMI is impacting on health, because that's really where the impact is. So we don't have a registry, and we don't at the moment have any way to find that out. And we have some studies that can give us an indication, but I think that would really help our case if we started thinking about obesity as a disease that impacts health, rather than, well, let's just see what shape and size everyone is and plan our services around that. The recruitment issues in the HSE, I think at the moment are I think we're all familiar with that. But again, that does make it difficult to get funding if we're not able to demonstrate that we'll be able to spend that money and recruit. So the funding streams that we aligned the model of care to, three main ones. So Sláinte Care Healthy Communities, and that was we used that funding stream to develop I suppose end-to-end interventions for childhood obesity and we got two multidisciplinary teams in two community areas for that. I'm not going to talk too much about that today. And then through enhanced community care, so through development of the chronic disease hubs, although obesity unfortunately isn't included in that framework, we did get obesity treatment services and a community-based treatment service implemented, and is being implemented in each of the 96 healthcare networks nationally. And then specifically for level 3 and 4 services, we leveraged the action plan for the waiting list action plan. So we all know waiting lists are a big problem, and they're a ministerial priority in the country, and obesity, I suppose obesity is contributing to a lot of those waiting lists. So there's funding available to address the waiting lists, and that's where our business case, that's the pot of funding, if you like, that we've submitted our business case to. So what does the implementation plan look like? So you can see here, our aim is to have 6 level 3 services nationally, and the map here shows where they are planned to be. So in Dublin we've got level 3, we've got here in St Columcille, and we've got down the line Naas and Connolly Hospital, and then we've also got Mallow General Hospital, Merlin Park and Nina. And then for level 4 services, the plan is to develop 3 level 4 surgery services, one in St Vincent's, one in Galway and one in Mercy in Cork. So what we have to do then is first of all plan what the services will look like, and then we have to cost them. So before I go on to the costing as well, the other thing that, because this is through a waiting list initiative, but again, funders will always ask you, well, what difference is this going to make, and particularly in terms of numbers. So again, we map out how many new patients those services are going to see, how many review patients, and how many surgeries. You can see there our plan is to bring the number of surgeries per 100,000 in the population up to 30, which is more in line with European standards. So when they're all set up, in 10 years' time, and you know, when it's all done, the total cost, obviously using this year's figures, will be approximately 20 million per year. So where are we at now? Well, we were really lucky this year to get about 6 million's worth of funding. That's 60, we call them WTE, it's 60 posts to uplift services here in Dublin, also in Galway, and in Cork, and in Children's Health Ireland, and to establish the new service in Cork. So we've got business cases in. We've got the budget next week, so we will find out after the budget if we were successful in with those business cases to fully implement, to begin the full implementation, and to broaden those services, and also to expand our clinical programme team nationally. And just to say as well, what else have we been doing? So as well as kind of going around knocking on doors looking for funding to implement the model of care, we've been busy, and Suzanne is here today. She has worked really hard over the last 18 months to develop a community weight management programme called Best Health. So we're involved there in the designing the programme, training the dietitians that will be delivering that programme, and supporting implementation of that programme nationally. We've been working on developing children's services. So I talked about our community specialist teams in CHO5 and CHO7. So they are in Rialto in Dublin and in Waterford. That's a full MDT that will be seeing children and young people with overweight and obesity. And also we're supporting the Sláintecare Healthy Communities. So that funding is for 19 communities in Ireland, and that is putting money into developing some of the level 0 supports, such as parenting programmes, community cooking programmes. There's also alcohol, tobacco programmes, and one more now, and sports partnerships as well. We're involved in training, education too. So we developed, and again, Suzanne led out in this project with a lot of the clinicians here also fed into it. So we developed Making Every Contact Count module, which is entitled Talking About Overweight and Obesity. And again, that was the aim of that module. And I'd encourage you, all of you, it's on HSE Land now, do go and do it. It's really to support healthcare professionals in having more helpful, non-stigmatising conversations around weight and health. We also have sponsored the development of the NIPC course, Delivering Evidence-Based Obesity Care, which started this week, and that's an online 8-module course for people working in primary care, again, to upskill in obesity care. We also continue our public engagement work and our communications work. So we have our Overweight and Obesity Let's Talk event. That's on the 6th of October. So again, I should have the registration details here, but the focus this year is on children and young people. But do come along, or you can join us online. It'll be live streamed as well. And we do that every year. And it's a collaboration between the clinical programme, the ASOI, and ICPO. So it's a fantastic event which is aimed at non-specialist healthcare professionals and also people with lived experience or an interest or concern about overweight and obesity. So it always proves to be a really well-attended and engaging day. And then we've also just recently launched some new guidance on the HSE A to Z about overweight and obesity. And again, I'd encourage you to go on there and have a read of it. We're really proud of it because when you look at the information about obesity that's out there on the internet, it's quite outdated. So we feel that the HSE has been a bit of a forerunner really in the information that we have up there at the moment. It's also in plain English, which can really help when you're explaining, when you're talking to patients. Sometimes it can be hard to get those messages across in ways that they can understand, especially with a complex condition like obesity. So that's what we've been busy with, and we'll continue, to work on all of those projects, and again work hard to try and get more services implemented as we go on. So just to summarise, obesity is a chronic disease. I'm sure that message is coming through loud and clear. For the model of care to work, we do need full implementation right from the bottom up to the top. There's no point in just preventing any more than there's any point in just treating or providing bariatric surgery alone. Training and education, but also ICT support is key really. And when we're thinking about developing registries nationally, seamless referral pathways, integrated care pathways, I think we will need to leverage technology there. Multi-sectoral support is also needed. Increased public awareness and knowledge, and again monitoring and evaluation. Anything that we implement and responding to that will be key as well. So thanks very much for your time and your attention. That brings me to the end of my talk, and I think Claire is up next. But if anyone has any questions, I'm happy to take them now or afterwards at the break.